Khi tiểu người ta đứng, con mình thì bảo con trai thì phải ngồi đái, mình cũng cảm thấy có mặc cảm tủi thân cho con.
Thien has hypospadias, a rare birth defect that involves an abnormally placed urinary opening. His family is poor, so spending thousands of dollars to have him treated at the National Pediatrics Hospital was just a dream. But then, by chance, Thui's parents learned of the Genital Reconstruction for Children program. In August 2011, Thien was examined, and only 3 months later, he underwent surgery. Dr. De Castro performed the 6-hour surgery, which was a success, much to the delight of the family.
Đứa cháu tôi sinh ra thì tôi cũng ở Hồ về hỏi bà cháu dai cháu gái. Thế mà cháu dai là hai cái đường tiểu này thì lúc ấy tôi rất buồn. Hiện nay được cứu chữa thì tôi thấy phấn khởi. Rất cảm ơn các bác sĩ, các nhà y học giúp đỡ cho gia đình tôi.
Sun and Thuy are just two of nearly 100 Vietnamese children who have been operated on by Dr. De Castro. His technique of phalloplasty using flaps and blood vessels can restore the senses in the penis. Notably, the reconstructed genitals can grow with the rest of the body. The price of this form of surgery in Europe and the US is between $80,000 and $100,000 US. However, thanks to the support from hospitals and doctors, the surgery in Vietnam costs only $2,000 US.
Dr. Roberto, can you tell me, what do you think is the biggest thing you've been able to do for Nhan and other little patients?
Well, when I had the opportunity to start thinking about these problems, it was about 15 years ago, not so long ago. At that time, the people thought, that surgeon, the doctor, thought that it was impossible to make a penis at that age. So the possibility are two. Wait for puberty, wait for adult age to have a phalloplastic, to have a reconstruction of the penis, or make a big mistake, change sex, reassign a female gender in a boy. That is a boy in the brain, yes. That is a male in the brain. So that's generate, particularly in the Western world, North America and Europe, they generate tragedies and tragedies. So I had the opportunity working, particularly in the Arab world and then around the world, to meet many of these boys, and even very young. And so we started thinking about the possibility to give them, the possibility to have a looking penis, a good looking, possibly penis. Sometimes even a functional one, but the majority is more just a cosmetical, not working like a penis, but have the appearance of the penis. But some of them, and I'm very happy to say that Nhan is one of them, can have also a reconstruction that we call functional, because we made for them the possibility to have a functional penis. That means having an erection in the future and work like a normal 100%.
Greg, can you brief us about what the program has done so far?
Well, of course, the obvious was Thien, which has been a 6-year journey. Now, hopefully with a happy ending. I think out of all of the patients that we are evaluating and have already performed surgery on, the idea is to continue that, obviously, because there is a lot of aftercare to be undertaken. I think the other issue, though, is, for lack of a better word, training. Because one of the things that I think so many people admire about Dr. De Castro is even when he first came to Vietnam, his second mission, he insisted that we try to organize, his first mission, that we try to organize a training workshop so that he could begin to but also teach Vietnamese surgeons his new technology, which is so important. Vietnamese surgeons are extremely good. I mean, they're some of the best in the region. As a matter of fact, one of Vietnam's first liver transplants was just completed at the National Pediatric Hospital. As far as immediate steps, it's important to note all of us work basically as volunteers. Dr. DeCastro and his colleagues who have come, there's no charge. Nevertheless, you know, there are expenses associated with these things, airplane tickets, hotels, moving 120 families. Actually, as Dr. DeCastro pointed out, probably 400 families now, moving them around throughout Vietnam, coming up here, putting them in hotels. A lot of the medical equipment and parts that are used are very specialized and extremely expensive. But it's interesting, for the past 4 missions, we've been able to achieve all 4 at approximately the cost of what it took us to go to Italy for one surgery.
Wow.
And to be able to impact so many families and young people, that's what gave us sort of this idea to take it forward. It's a surgery that won't be seen, but it profoundly changes these young children's lives. So we hope to keep growing this. Dr. DeCastro has committed that he wants to stay involved with this for as long as he can, and I think all of us also are going to continue our effort to make this happen.
That's fantastic.
Following a long day in the operation theater, Dr. DeCastro walks back to his hotel. After staying there for 2 weeks, he knows a shortcut through a small alley near the hospital. Every morning he walks to the hospital to examine patients and perform surgery. When he comes back in the afternoon, he goes straight to his laptop to write up his notes on each case.
It's very, very important not to forget anything about the patient. All my life I will think that it was very important for all my patients, not only here but everywhere, to be so precise in the file, to make a nice file. So in the future, when you see the patient, you can very well understand what was done and what the patient need, and you don't have to come back and repeat all the questions to the family.
No days off, no sightseeing, just pure devotion to his child patients, sometimes performing operations that can last up to 10 hours. Dr. DeCastro says he wants to volunteer to come to Vietnam twice a year to perform medical examinations and surgeries on child patients for 3 weeks at a time, and he doesn't want any remuneration. He also once said to the Vietnamese press, "I'm sorry that I've come with just these 2 hands. I try my best to keep the price of surgery in Vietnam at a fraction of the price of similar procedures in Europe and the US. I hope that people across Vietnam will join hands to give the little patients a ticket to adulthood."
So far, how many children have you offered to help, and in what way?
We want to help anyone who walks in the door. And I now say to people, you know, it's like a lottery. If one of these kids manages to come in and we see them, we have really not turned away anyone yet.
Wow.
But most logically is, of course, Dr. DeCastro's high experience that he can judge really who is going to be a good candidate for the program.
Can you tell me about the biggest challenges that you have faced so far?
Well, I have to be honest, that would be funding. Because there are many, many noble causes out there. I think from a medical standpoint, it's just the reality. Institutions, the medical community, governments, they need to put most of their the available funding into programs that are going to benefit millions of people. Malaria, dengue fever, typical childhood diseases. And so that makes it even a bigger challenge. I don't think, there's not anybody when they hear about this or hear the magic that Dr. DeCastro performs is not impressed by it. But the fact of the matter is there's just not much public awareness of it anywhere. And there's also very little funding available. So I think part of the beauty of trying to do this in Vietnam, which is is still a developing nation, is that this is going to become the state-of-the-art place that I think other surgeons and other families from throughout the region will be able to come to. And I'm very confident that we will be able to raise that money, but it's not easy. So that's probably the biggest challenge.
So hopefully today on Talk Vietnam we can spread this out to more people.
I hope so. And in fact, it's worth pointing out, in the West, these typical operations regarding genital surgery can be $50,000 to $100,000 US or more. And if you amortize what we've been doing at each mission, we're doing it now for probably $2,000 or $3,000 a child.
Wow.
So it's really, in terms of an investment in this new field, there's a pretty big bang for the buck. So we do hope that people will see their way to want to help these children, as many people do for my example of Operation Smile.
Chị Mai Anh, em sẽ muốn hỏi thêm một câu với chị nữa là chị có thể kể cho em một chút về sự hưởng ứng hoặc là giúp đỡ của cộng đồng không? Có nghĩa là cái funding mà mình vừa nói đến.
Có một điểm đặc biệt của những cái đóng góp đấy, có lẽ cũng bắt nguồn từ những cái đóng góp đối với bé Thiện Nhân. Đấy là của những cái sự quan tâm của các con người với các con người với nhau. Và cái sự đóng góp đấy rất đặc biệt của việc nó từ những con số 50.000, 20.000 cộng dồn lên để có gần đấy ca phẫu thuật, thì phải hình dung đó là hàng trăm, vài trăm hoặc hàng nghìn cái sự đóng góp của các cá nhân khác nhau đã đến với chương trình Góp Gió Để Thành Bão.
Vâng. Chị có thể kể cho em một câu chuyện nào đến cảm động về tấm lòng hảo tâm không?
Một câu chuyện cảm động. Trong các câu chuyện cảm động, một ngày chuông cửa của nhà tôi kêu, và có một người đàn ông trong bộ dạng sau ca làm về rất là lem luốc đến xin đóng góp 50.000. Và chắc chắn công việc của anh ấy rất là vất vả, và 50.000 đấy đối với mỗi người của chúng ta có thể là một phần của một ngày đi chợ, nhưng với người đó thì có thể là nhiều bữa ăn. Và vẫn tự nguyện đóng góp cho chương trình để với mong muốn là góp một hạt cát nhỏ để giúp nhiều những cái em bé khác. Cái sự chia sẻ đấy rất đáng quý, và thực sự là chúng tôi rất xúc động. Chúng tôi vừa muốn nhận số tiền đấy, vừa muốn không. Nhưng trách nhiệm của mình là nhận, nhưng nhận rất là chịu lòng, và cũng rất là mong nhận được nhiều những sự chia sẻ, khởi nguồn từ những cái sự chia sẻ khi mà bản thân người nhận cũng rất là chịu lòng như vậy. Và cũng từ đấy thì mới có nhiều những ca mổ mà chúng tôi đã làm trong thời gian vừa qua.
You know, a similar story, the one that always sticks with me was a young man who his genitals had been eaten when he was very young, and his father, who was a veteran and very sick and in a wheelchair, came to us and offered very seriously that the child was a little bit older. He was a teenager by this point, so a whole lifetime without genitals. And this war veteran, Vietnamese war veteran, came to us and said that he wanted to donate his penis and genitals to his son. Now, you know, obviously that was not medically possible or feasible, but the thought of that, you know, a parent would give up such an important part of his life for the benefit of his child was extremely touching to me, and I think all three of us have never forgotten that story.
Yeah, it sort of shows this love that has no borders.
Right.
Yeah, that's an amazing story. Thank you for sharing that. Chị Mai Anh ơi, em xin phép hỏi chị thêm một câu nữa. Một gia đình mà muốn được chương trình hành trình thiện nhân giúp đỡ cho con mình thì sẽ phải bắt đầu từ đâu nhỉ?
Nếu như mà các cháu bé bị những cái hoàn cảnh tương tự, khiếm khuyết bộ phận sinh dục, thì có thể gửi thư đến chương trình rất là đơn giản, ghi rõ cái hoàn cảnh bị thương do bẩm sinh hoặc do tai nạn, thời điểm và những lần chữa trị, kèm theo hình ảnh chụp của những vết thương và tất cả những cái hồ sơ bệnh án từ trước đến nay nếu như có. Và nếu như những cái bệnh nhân đấy nằm trong cái lĩnh vực bệnh mà chương trình đang quan tâm, đang chăm sóc và chuyên môn của bác sĩ Roberto cũng như các bác sĩ tình nguyện của chương trình, thì chúng tôi đều đặt lịch hẹn cho các cháu đến. Những cái gia đình muốn giúp thì làm đơn và gửi về địa chỉ chương trình tái tạo bộ phận sinh dục cho các bé 12B Ngọc Khánh, Ba Đình, Hà Nội.
Well, thank you so much, Mayang and Greg Kraft, for joining us and for what you've done for the kids. I think I'm not the only one here appreciating the great work that you have done. And thank you for your time today. We wish you all the best of luck in your future journeys, and I hope you will be able to spread out more and more help, and more people will take part in, you know, participating to help other kids as well.
Thank you very much.
Thank you. Can you tell me a little bit more about the surgical method that you've invented?
My technique is inspired of another technique of phalloplastic that was introduced by Mr. Prior, that is an English surgeon. And he suggests to create a penis and to create the urethra using a flap from abdominal wall. Apparently, this procedure was not successful in the adult life very much. Probably because they pretended at the same time to make the penis very long and the urethra as well.
Yeah.
I thought that we can use the flap only to create the penis, and maybe we can do the urethra. We can create the urethra, so the conduit for the urine and the sperm to go out, with some in different way. So I thought it was possible to use a tube of bladder mucosa, or a tube of cheek mucosa, or of labial mucosa, or a combination of this, and to insert inside of the flap, and then make a penis and the urethra at the same time. Then I realized it was not safe to do that. Better to do the penis first time and then maybe wait for some more steps to do the urethra. And so I starting to develop this, and every child I did in the beginning of my experience make a little difference, because then we realized that we need something inside to have you know, the penis stay in the right position, not move too much. So we use some muscle from the abdominal wall that they are incorporated in the flap. So this is what the development. Now we reached the 32 phalloplasties was done already, and the majority in Vietnam, because we did 5 in Vietnam. So it's a big number. If you consider that in Italy we did only 3 or 4 in Italy, and the rest around Europe, United States, South America, and Middle East, and Far East as well.
What are the prospects or advantages of widely applying this new surgical technique in Vietnam?
Luckily, this tragic problem, are very rare. If you think about congenital absence of the penis, this is one case every 20-25 million birds. So you mean in a population like Vietnam, probably we already finished all the cases, because talking about congenital, because it's a very rare situation. But we have the traumatic, but we have the what we call iatrogenic. That means people that was born with a normal situation, but they receive some very bad operation, like the simple circumcision. Sometimes even the simple circumcision can you know, destroy completely the penis if you do really in a bad way. So there is many other situations in which my technique can be applied, and so I hope that particularly at the moment the doctor for the National Pediatric Hospital in Hanoi, that very good, and they were with me all the time. during my missions, and they are ready now. They are ready to do the surgery together with me and without me. So I hope my technique will be helpful for many more patients.
What can you say about the rate of success of all the surgeries up to now?
Psychological point of view, 100%. The improvement is
excellent.
fantastic. A cosmetical point of view, I have the exact number because we review recently all the cases. I can say that we have 70% acceptable result,
Wow,
good
that's amazing.
or good after revision. Cosmetical point of view, not too bad. And functional point of view, I have only few patients that I can say we did a functional reconstruction. They have a normal penis. They can void, they can have erection, they can have everything. I have some of them, are very few.
Excellent. Have any of your patients talked to you about their sexual lives? Have they said you have helped them with that or no?
For the time being, no.
Not yet. They're too young.
Yeah, too early for that. I hope to answer this question that is, for me, is one of the most important questions. Very soon, to have the answer. For the moment, it's just a dream, it's just a hope for their future.
Okay. Thank you so much for joining us on the show today and sharing your stories as well as helping Thien and other patients.
Thank you.
I hope to see you again sometime soon.
Thank you.
Hopefully learning more
I
about
hope
your
so.
patients.
I hope so. Thank you very much.
Thank you so much. And it's time for us to say goodbye now. I hope you enjoyed the show as much as I did. I'm Ola Ding. Let's talk Vietnam again next time. Goodbye for now.